My first volunteering trip was in December 2022.
And we went to 2 countries.
We went to Philippines and Cambodia.
It was so amazing. We decided to do it a second time.
We just loved it. We really had a good time. We connected with the kids there, even though we couldn't speak their language, but we could feel that, we in touch them in a particular way.
In the Philippines, one of the biggest issues was rape and neglect for the little children. So we would see the medical consequences of that. So a lot of malnourishment, a lot of psychological problems were very present.
There's also very low priority for health. It's like Maslow's hierarchy of needs. Like if you already don't have shelter and food, you're not really going to seek your health, and you're not going to prioritize that. So there were people that, you test their blood sugar level and the machine wouldn't even be able to read the number. It would just say hi. And you'd send a note with them and be like, please go to the hospital if you can, but they're dismissing it and it doesn't really matter to them much.
Having lived in the West, having lived in a built-up environment where there's all these supports, all these government assistance, going there and seeing that not being present, or all of the things that we take for granted not being there, you can see a great need. Particularly Cambodia. Cambodia was a tough one because they had 8 million people, and then in the 1960s, I think it was the end of the 1960s, they had a massive genocide. 3 million of the 8 million people were killed, and of that, all of the educated people were killed. The experience that they had there was that, like, when it came to dental care, when we came to take teeth out as an extraction, they would refuse to have their teeth extracted even though it was infected and causing them severe pain, only because they were convinced that if they took their teeth out, there'd be evil spirits. And that's because the dentists that were working on them previously were uneducated. They didn't know how to do extraction, so they convinced the patients that if you extract your teeth, you would be possessed by a demon.
There wasn't a lot of medical knowledge, and I guess that comes from the war and the history of the country. But a lot of people were not willing to seek medical help in the first place.
I think definitely going to the villages that they were living in, you can already tell it was the poorest of circumstances. Like you look at their houses, imagine you and the cattle and the street dogs, you're all living in the same house, in the same place.
From what I saw, there isn't much education support that they have. Some of them were over the age of 12 and weren't able to write their names or spell out their names, which is very sad, because being a teacher, you should know your name from the age of 2 and should be able to write your name.
They also had limited access to healthcare centres, and not just that, they don't have the finances for medical support. Also, their medical knowledge is very limited, and it's not a priority for them at the moment. The priority is just to get through day by day. It doesn't matter if they're in pain or not. That's just what they're used to.
I'll never forget, we went to an orphanage and there was a room upstairs that had a sign on top that said isolation room. I was just curious to know why this room existed, and I looked in, there were 2 girls there and I saw 2 babies as well. I stood watching in through the window and I noticed that one of the babies was crying, but the mum wasn't really getting up, so I called the doctor back in.
The doctor who was there, he didn't want to do anything, and Mia said, "You should wake up the mother, I think the baby wants to have a feed." And the doctor said no, and then You said, please.
Minutes later, the poor baby was screaming on top of its lungs. So I called the doctor again. I said, I need you to wake the mum up because the baby's very distressed. So he woke the mum up. The poor mum obviously looked very, very young. So it turns out the baby needed to be changed and fed. So she did that. And while she was doing that, I had a bit of a conversation with her and I said, you know, what's your name? And she said, so-and-so. And I said, how old are you? And she said, I'm 11 years old. And I said, wow, okay, and you have a baby? And she said, yeah, my baby's 2 years old. That makes you think this poor girl fell pregnant at the age of 9. And I think the comment thereafter that she made really, really broke my heart, where she said in Filipino, can you please look after my baby so I can go play with my friends?
That's right. And the 11-year-old should be playing with other kids, not taking care of a baby. That's way too young. But her parents have failed her. Society has failed her. And even this doctor, he didn't really care about her. He was just there doing his job and that was it. There's so much that we can do, so much that we can give. And we feel like every trip that we go, we see miracles. We see people who appreciate the services that we offer as if it's something that was sent to them from God, because no one else goes out and does this kind of work for them. No one else cares about them enough to come and to give them free medicines or give them free checkups.
What Thanksgiving is already doing is making a big difference in their lives. And I think what Thanksgiving can continue to do is the education part. Educate them about medical conditions, about seeking help earlier, raising health awareness, also outside of the medical field, just education in general, laying the foundation for them to continue to grow without, people being there physically to help them.
Part of the mission of Thanksgiving Australia in these countries specifically is setting up clinics. What we would like to see, and Dr. Nasser was with us in Cambodia, and this was, I guess, his vision for Cambodia specifically, was to set up a clinic at the NGO, the non-government organization building that they have there, where patients can come in regularly every day for people who can't afford to see a doctor. And they'd have a doctor that they hire. They then, we educate them and give them services that they can then contribute to their community. And so what you then see is that Cambodians are serving Cambodians.
So we're there to provide them with a better life, better lifestyle, and hopefully educate them so then they can educate other people as well. So it's kind of like a domino effect. So you help others and they will help others as well. So
we would go to rural villages that are kind of like 3 hours away from the main city, from Phnom Penh. So they were really lacking medical access and lacking access to clinics. So Thanksgiving Australia can definitely help in transporting equipment that they might need there, whether for health or dental work or education, to keep the community self-sustained, and maybe one day have a clinic there that's in one of the villages that a lot of people can come to if they can't access hospitals in the main city.
And even going back to Australia got me thinking, how can we help these girls a little bit more? And maybe it was more education that we need to provide, around our bodies and how to keep them safe, how to set boundaries effectively and things like that. So as to try and avoid these kind of teen pregnancies in the future.
There are heaps of people that are in need and they're underserved. We need to send, there need to be a lot of people that are willing to go to be able to have regular mission trips and provide regular aid for those people that genuinely need it. You have breakfast in this hotel and then you go into a very, very poor village. All they're eating is rice and they're drinking, the water is pretty much brown. And then we get dirty, we sweat, we go and we stand in the rain and all of that. But then we come back to the hotel and you kind of know, you're comforted by the fact that you're going to go back and you're going to have a nice shower, you're going to have a nice hot meal, but for them, this, like what you thought was struggle for you, that's their whole life, and I think it was inspiring in the sense that you want to do more, you want to help them, you know, have a better life, have better access to healthcare, you know, adequate food, clean water.